What anesthesia is used for raw joint replacement? When it comes to joint replacement surgery for patients with rheumatoid arthritis, you might wonder what types of anesthesia are typically used. The options mainly include general anesthesia and regional anesthesia, with many medical professionals leaning towards regional anesthesia when it is feasible. General anesthesia is a method that uses intravenous medications and inhaled gases to make the patient fully unconscious during the procedure. This approach requires careful airway management, often involving intubation and mechanical ventilation. While general anesthesia is effective, it does carry some risks, such as respiratory depression and potential complications after surgery. These risks can be particularly concerning for patients with rheumatoid arthritis, as they may have additional systemic health issues. On the other hand, regional anesthesia is frequently preferred, especially for lower limb surgeries like hip or knee replacements. This type of anesthesia includes techniques such as spinal and epidural anesthesia, as well as peripheral nerve blocks. Spinal anesthesia involves injecting local anesthetics, such as bupivacaine, into the fluid surrounding the spinal cord. This results in numbness and muscle relaxation in the legs while allowing the patient to remain awake or lightly sedated. Epidural anesthesia is similar but allows for continuous administration of anesthetics through a catheter, providing prolonged pain relief. Peripheral nerve blocks, like femoral nerve blocks or adductor canal blocks, can also be utilized. These can be used alone or in combination with spinal anesthesia to deliver targeted pain relief while maintaining muscle function. This is particularly beneficial for early rehabilitation after surgery. Advances in ultrasound guidance have significantly enhanced the accuracy and effectiveness of these nerve blocks. From the perspective of rheumatoid arthritis, regional anesthesia offers several advantages. It tends to reduce systemic complications, lower the risk of blood clots, and may help manage postoperative pain and inflammation by blocking pain signals during and after the surgery. However, the choice of anesthesia should always be tailored to the individual, taking into account the patient's overall health, the severity of their condition, and the expertise of the anesthesiologist. In summary, joint replacement surgery for rheumatoid arthritis often utilizes regional anesthesia techniques like spinal or epidural anesthesia, frequently combined with peripheral nerve blocks. This approach aims to optimize pain management and minimize risks, although general anesthesia remains a valuable option depending on specific patient and surgical considerations. Always consult with healthcare professionals to determine the best approach for your unique situation.